A laparotomy is a surgical procedure involving small incisions through the abdominal wall to gain access into the abdominal cavity. It is also known as a coleotomy. This operation is performed to examine the abdominal organs and aid diagnosis of any problems, including abdominal pain. In many cases, the problem once identified can be fixed during the laparotomy. In other cases, a second operation is required. Staging laparotomy for Hodgkin's disease or lymphoma includes splenectomy, needle or open biopsies of both liver lobes, possibly also removal of abdominal nodes, abdominal node and / or bone marrow biopsies, ovarian repositioning. The physician makes an abdominal incision and the abdomen is explored. The spleen is mobilized, divided from its vascular supply and removed. Needle or wedge tissue samples are obtained from the left and right lobes of the liver for separately reportable analyses. Abdominal and retroperitoneal lymph nodes are identified and sampled. A bone marrow biopsy may be obtained. The ovaries may be plicated out of a planned radiation field. The incision is closed. Laparotomy, for staging or restaging of ovarian, tubal or primary peritoneal malignancy, second look, with or without omentectomy, peritoneal washing, biopsy of abdominal and pelvic peritoneum, diaphragmatic assessment with pelvic and limited para-aortic lymphadenectomy. This procedure is the second operation to check for a recurrence of the ovarian malignancy. Through a full abdominal incision extending from just above the pubic hairline to the rib cage, the physician may elect to remove the omentum, a membrane of lymph, blood vessels, and fat that forms a protective layer that extends from the stomach to the transverse colon. The physician may flush the lining of the abdominal cavity, peritoneum, and remove the liquid to check for cancerous cells. A tissue sample of the abdominal and pelvic peritoneum may be taken. The physician also may examine and take tissue samples of the diaphragm. The pelvic lymph nodes are removed and a portion of the lymph nodes that surrounds the lower aorta within the pelvis is removed. The abdominal incision is closed with layered sutures. Laparotomy, with aspiration and / or injection of hepatic parasitic, e.g., amoebic or echinococcal, cyst, S, or abscess, ES. The physician performs aspiration or injection of liver parasitic cysts or abscesses. The physician makes an abdominal incision. The liver is mobilized and the parasitic cysts or abscesses are identified. The remaining abdominal contents are packed off with sponges for protection. The cysts are aspirated with a needle and syringe or unroofed and aspirated and may be injected with a hypertonic solution. The abdominal incision is closed. Exploratory laparotomy, exploratory coleotomy with or without biopsy, S. To explore the intra-abdominal organs and structures, the physician makes a large incision extending from just above the pubic hairline to the rib cage. The abdominal cavity is opened for a systematic examination of all organs. The physician may take tissue samples of any or all intra-abdominal organs for diagnosis. The incision is closed with sutures. Reopening of recent laparotomy. The physician reopens the incision of a recent laparotomy before the incision has fully healed to control bleeding, remove packing, or drain a postoperative infection.